I chose to further my education because I was at a point in my career where I knew I was capable of more.
The entire RN to BSN program is online, which makes it very convenient for me and for others because I am not only a full-time nurse, but I'm also a full-time mom.
Many facilities are actually requiring their nurses to have a BSN degree prior to even hiring them.
The benefits are immeasurable. I graduated with a bachelor's degree. It was in political science. I kind of took that degree and did a lot of different things. I was making a very good living. Got married, had a kid, and my dad got cancer. What I saw through that experience with my father was that these nurses, and really everyone in these healthcare environments, were making a profound difference in the lives of individuals who were at a very vulnerable point in their life. When I would go back to work, it almost seemed like I wasn't doing enough.
I saw the nurse practitioners working with the surgeons very closely, helping them with the surgeries, and just that greater level of responsibility and education was something I admired.
When you complete your associate's degree, you do not get a lot of your humanities courses. So really I wanted to broaden not only my knowledge, but my knowledge of different cultures. It just made me a much more well-rounded nurse.
It's looking good. After our youngest daughter graduated from high school in 2011, I started thinking about continuing my education. At the time, Sanford was having magnet surveys and talking about the positives of having your bachelor's.
It's important to have BSN prepared nurses in our society as they're able to translate some of the research-based evidence into the practice care centers where we're taking care of more complex patients. The clinical partnerships range from Brookings, Sioux Falls, Aberdeen, and we even send students for their preceptorships to Minnesota, Nebraska, Iowa, North Dakota, and South Dakota.
Allison and I have worked together for about almost 4 years, and our role is very similar. And when we're at work, she doesn't call me Mom, she calls me Beth.
This semester I'm in a research and theory class and just seeing kind of the backside of the research. With my online courses, I'm seeing how it's all presented and how it's all formulated and how it all comes together.
The advisors of the program recognize that you have potentially a family at home or a busy lifestyle at work, and they're able to work with you. It was also a very affordable program for someone that was planning to start a family.
I used to take a fair amount of pride in the interventions that I did help my patients to get better. My patients don't get better anymore. All of my patients die. But what you have to look forward to is knowing that you're saving up to 8 people with organs on the other side. I have found since I completed my BSN that I write papers much more professionally. I write emails much more professionally. I can also look at a nursing article in a research journal and look at it critically.
I am a Native American from Rosebud, South Dakota, a member of the Rosebud Sioux tribe. Our Native population is not as wealthy as most populations, so I wanted my BSN so I could make a difference in the public health realm by going into their homes and helping them and not making them feel uncomfortable. I feel that the BSN helped prepare me for that very well.
There's so many different opportunities and there's so many different settings that you could practice in. It is such an appealing profession.